Good evening and welcome to our RC Expert webinar series. This evening we will be discussing from laser hair removal to pigmentation and vascular treatments, the benefits of having a Gentle Pro Series device in your clinic. Our presenter this evening is Marguerite Burke. Marguerite is a registered nurse. She has a strong clinical background, having worked in public hospitals for over a decade, including medical and emergency settings. She's also worked in dermatology and aesthetics arena, so she appreciates and understands both the clinical and cosmetic value of energy-based devices for the skin health and anti-aging phase throughout the lifespan. I'll now pass you over to Marguerite.
Good evening, everybody. Thank you so much for listening in on this chilly evening. As Mike said, this evening we're going to be taking a look at the Gentle Pro Series laser and some of the benefits associated with this device. So initially we're going to have a look at the bread and butter of this laser for many salons and clinics, which is laser hair removal, but then also the added benefit that we've got this device where we can advance to pigmentation and vascular treatments. So it's fair to say that the presentation this evening is probably more focused towards cosmetic and beauty clinics and arena, but we will touch on some medical as well. We'll be having a question and answer at the end. So if there's anything that you would like more information on along the way, if you save that up to the end, then hopefully I'll be able to help you with some answers. So just having a little bit of a closer look what's on the menu tonight. We're just going to have an overview look at the Gentle Max platform and then discuss in a little bit more detail what's special and what's so beneficial about the dual wavelengths of laser hair reduction on this device, and then how we can also increase our skill set for this device in the appropriate settings to value add and treat certain kinds of pigmentation and also vascular indications as well. We'll finish up by taking a brief look as well at our skin rejuvenation technique option as well, neocollagenesis technique. And then I just wanted to have a little bit of a chat at the end before question and answer, just about when we've got this wonderful device, this wonderful platform, how do we really tie this all together in one piece and ask ourselves the right questions about what's going to be the most benefit to me and my clinic and my clinical setting, and then how can I advance and progress with that over the course of time. And we'll finish up with some questions and answers at the end. So just having a little bit of a closer look at what makes up the Gentle Max Pro platform. So this has been in development with increasing innovation over the past 20 years. Originally, we started with the Gentle Lathe. It was just a 755 nanometer wavelength for laser hair reduction, which was developed back in 1998. And then over the course of time, we've increased our innovation with this, and it's become a very upgradable and versatile platform to suit what we need in our own clinical setting. And so what we have now is the Gentle Max Pro, which actually consists of two wavelengths, which can be used for hair reduction, and then also the treatment of vascular and pigmented lesions, and then some other indications as well, some of which are more focused in medical environments too. And so the nice thing about this is that not only can we start with a laser hair reduction platform, including two wavelengths, which means that we can treat across the whole spectrum of Fitzpatrick skin types, but then once we have that modality in place and we're looking to upskill our staff and increase the return of investment on our device, there are other clinical indications that we can look to add to that as well. So what we can see here is we've got our Alexandrite 755 nanometer, and what we'll be talking about this evening is how we use that for laser hair reduction and then also the treatment of benign epidermal pigmented lesions. And then with our ND-YAG 1064 nanometer wavelength laser, again with laser hair reduction, and then also vascular lesions and our collagen induction or wrinkle reduction treatment. Another clinical indication that you can use the ND-YAG for is also for treating onychomycosis nail fungus. Generally speaking, that's something that's more focused in medical clinic environments, or often where we have allied health staff present, such as podiatrists, who may also be interested in using that part of the platform. So we won't be focusing the discussion so much on that today. So having a little bit of a look at the specifications of the device, some of the things that are nice to point out here is the variability that we have. So not only between two wavelengths, but some of the features that allow us to have this scope of being able to perform a whole range of different treatments include the option of spot sizes that we have available to us. So what you can see there is that we have a standard handpiece that encompasses 6 millimeters to 18 millimeters. And so that's what comes standard with your platform device, which would enable you to treat for laser hair reduction, pigmentation treatments and skin rejuvenation treatments. But then further to that, we've also got what's most popular as our large specialty spot size handpiece. So this is our specialty laser hair reduction handpiece, and it's got an increased treatment size area between 20 to 24 millimeters. And then in addition to that, we can also upgrade to our small specialty spot size, which is our vascular handpiece. So this is the handpiece that we can have with our device using the ND-YAG 1064 nanometer wavelength that allows us to treat small facial vessels and leg vessels as well within that. That's also the system that we would use for treating the fungal nail as well on the 5 millimeter spot size. It's nice to know that we can operate between a finger or a foot switch based on our preferences. As some of the key features of the device that we've got here. Another important thing to note is the variable pulse duration that we have available here, 0.25 to 100 milliseconds. And this is what lets us, between those two wavelengths, be able to successfully treat the various clinical indications that I've mentioned, which we'll be having a closer look at in some more detail. So firstly, let's have a closer look into our laser hair reduction wavelength. And so what we can see here is that when we talk about laser hair reduction, we're referring to a long-term stable reduction, usually where we're happy with about 80% in the number of hairs growing when people complete a full recommended treatment regime with the appropriate amount of time that is spaced apart. And so getting back to the real nuts and bolts of everything when we're looking at the GentleMax Pro device and really why Candela has chosen these wavelengths as the gold standard for laser hair reduction, we get taken back to our absorption curve where we're looking at the way that different wavelengths prefer to seek out certain chromophores or colours in the skin. So when we're talking about the chromophores that a laser wavelength prefers to seek out in the skin, we're usually referring to melanin, our pigment, such as with our hair follicle or pigmented lesions. We're also referring to hemoglobin, which could be oxy or deoxyhemoglobin, sometimes more preferentially as well. And what we're looking at there is also how we can utilise certain wavelengths for blood vessel treatments too. And then the third one that we don't see there on the diagram is water. But when we're looking at this in relation to laser hair reduction, what we want is a wavelength that is going to be nicely attracted to the melanin chromophore. And we know that when we examine a wavelength, it's not only telling us what chromophore or colour in the skin it prefers to seek out, but it also gives us some information about the depth of penetration that this laser can achieve into the dermis of the skin. And so when we put these factors together, that becomes important to us from both a safety and also from an efficacy perspective as well. So what we can see when we look here is that we've got a Ruby 694 nanometer wavelength. And when we look at that brown sloping line there on the graph, we can see that with Ruby, which was sort of a first generation of hair reduction lasers in the laser cosmetic industry, that it really loves pigment. That brown line is higher than that red line significantly, and it loves to seek out pigment. And so what we found is that for first generation hair reduction, that the Ruby 694 nanometer wavelength was very effective at targeting the pigment in the hair follicle, But the safety consideration there was that it didn't actually penetrate as deep down into the dermis, which means that we were attracting more heat up close to the surface of the skin. It was a very effective option for paler Fitzpatrick skin types such as Fitzpatrick 1 and 2, but then when we were progressing through deeper Fitzpatrick skin types, the risks there for burns and blisters, crusting and unwanted side effects meant that it wasn't the most worthwhile wavelength. And then we move on to our Alexandrite 755 nanometer wavelength, which makes up one part of our Gentle Max laser for hair reduction. And so what we can see there is it prefers to seek out pigment compared to seeking out blood. And it travels just a little bit deeper down into the dermis, so a little bit further away from causing that excessive heat injury higher up in the surface of the skin. Further to that, then we can see that we've got diode. So diode is another form of lasers that are available out on the market for laser hair reduction. And we can see there that that's sitting sort of a little bit further down, but somewhere a little bit less so when it gets attracted to melanin compared to the Alex 755 nanometer wavelength. So we're going to see in 1 minute why that's an important choice about the benefit and why most consider that the Alexandrite 755 nanometer wavelength is the preferred and gold standard for laser hair reduction in paler Fitzpatrick skin types. Moving right on down that slope there, what we can see is that we've got our 1064 nanometer ND YAG wavelength. Now that brown line and the red line, they're pretty close together. So it's sort of not exactly best friends with either when we compare that to our Alex wavelength. But the thing is that when we're thinking about trying to achieve the best results with laser hair reduction, we need to know that safety is first and foremost our top priority. And so we want a laser that's going to be inclusive, it's going to be able to treat all Fitzpatrick skin types. And that's the importance of having this second wavelength, the ND YAG 1064. It travels a bit deeper down still into the deeper dermis, 1064 nanometers, and it makes it a safer option when we combine that with the fact that its attraction to melanin isn't quite so great, in particular when we'd like to have a laser hair reduction treatment option for darker skin types, so Fitzpatrick 4 to 6. These are the people that have got competing chromophore in their skin, and so we don't want to be the laser to be distracted by that pigment that's in that epidermal or dermal epidermal junctional region there for them. When we look at our graph here, we can see what the real significance is when we compare the 755 nanometer wavelength to the 800 nanometer diode laser hair reductions by comparison. So what we can see here is that by choosing the 755 nanometer wavelength, which is suitable for Fitzpatrick 1 to 3 skin types predominantly, our absorption, our attraction, our preference to melanin is actually 133% higher when we compare that with a diode option. And so what we can see here is that Candela, based on evidence, has chosen the best wavelength in order to have the best opportunity for attraction to pigment in order to best target laser hair reduction. But then what Candela has also done is that they've made sure that we still have an inclusive and valuable treatment option that is also effective for treating darker Fitzpatrick skin types as well with our 1064 nanometer wavelength too. So having a quick look at how laser hair reduction works, the mechanism of action there is through selective photothermolysis. So we're making choices through our wavelength and through our treatment settings about how we're preferentially going to seek out the pigment chromophore in the hair follicle, and we're going to have an absorption of light energy that gets transferred into heat, which in turn is going to diffuse and damage our hair follicle. And so it's important when we think about the process and the action of laser hair reduction that we are able to target the bulb, the bulge, and the vascular supply. So what we have with our Gentle Max laser is 2 wavelengths that we can use to treat all Fitzpatrick skin types. That is going to travel and transfer that heat to a depth in the dermis that's going to allow us to damage those crucial structures within the hair follicle in order to have the best results as well. So when we think a little bit further about how we can best achieve this penetration in order to achieve selective photothermolysis, this is where we can start looking at the benefit of the large spot specialty laser hair reduction handpiece that's available with the GentleMax device, so the 20 to 24 millimeter spot size. So the advantage of a larger spot size actually isn't just purely that because it's bigger, that it means that we can perform our treatments in a more timely manner and cover a greater surface area more quickly. But what this slide is actually demonstrating is that there's also clinical benefit in utilising a bigger spot size when we're trying to treat a field or a surface area such with laser hair reduction. So what we can see here, if we suppose that diagram on the right is our largest spot size, perhaps a 24 millimeter spot size, for example, we can see that our depth of penetration takes better advantage of that laser scattering as well, and it equates to a better coverage and depth of penetration of our surface underneath the skin there, which means that we can achieve a good penetration of our hair follicles with lower reflective fluences as well by using that bigger spot size too. So what we can see by having this large handpiece is not only are we increasing some time and efficacy within the way that our clinic might run, but there also actually is some clinical benefit associated with being able to do that too. The other thing that's special about the GentleMax laser system is the cooling systems that are available. And so we know that when we are trying to selectively destroy our target by causing this controlled heat injury via laser for our hair follicles, that we're really working at matching our fluence, our heat energy, and our pulse duration, the time that we deliver that heat energy, within the pulse itself to try and match that to damage the hair follicle without causing too much collateral damage to the surrounding skin. But in addition to that, we still like to do our very best to first do no harm and to protect the upper layer of the skin. So with the GentleMax laser device, you've got two different cooling systems that you can choose from when you're configuring your laser platform when it comes to laser hair reduction. So the main option that is most popular in Australia is our Zimmer cooler. So this is a continuous air cooling system that blows refrigerated air continuously on the skin while we're treating with the laser. So many people like this option because there's no consumable involved once you have the Zimmer machine itself, which means that it's cost effective over the long term. The other benefit of having the Zimmer cooler as part of this option for your laser hair reduction is that the buck doesn't stop there. So we know that post-treatment cooling is so valuable to us when we're considering lots of laser treatments, that post-cooling is an important part of that aftercare process. So the Zimmer cooler doesn't only need to be limited to using that for your hair reduction, but you'll find that will come in use to you throughout your clinic in general when you're exploring other clinical laser treatments and even maybe sometimes other clinical modalities such as cooling to assist with comfort with chemical peels and things like that as well. So you can really maximise the benefit of what the machine has to offer within your clinic beyond just using it for laser hair if you so choose. The second type of cooling system that is available that you can use for laser hair reduction is Candella's patented dynamic cooling device, or DCD as we call it. And so this is where we have a cryogen spray that actually gets emitted when we press the trigger to pulse the laser. And it lets off a spray of extremely cold, frosty air on the surface of the skin right before our laser pulse fires, and then in certain situations with other treatment indications after laser hair removal, it might also sometimes let off a post spray as well. And so what we have here is a rapid and very controlled cooling of the epidermal layers exactly in time with the laser fires. So it's not independent of the user based on how quickly we move it along, this is happening within every single pulse. And so a reason that this can be an advantage to some people in their clinical settings might also be when they really do prefer to have this precise control over their cooling mechanism, but also because it's an integrated system into our handpiece. You can see the picture on the right there, that it's an integrated system in the belly of the handpiece, and the DCD wiring runs and fires through a nozzle at the end of the handpiece. So for you, if you're thinking about your clinical environment in your clinic room, space is always a big issue. And when we think about the size, that having a laser and then the additional size of having an air zimmer cooler, for some clinics, they might prefer to have that option of having the all-in-one system and use the cryogen cooling as an alternative option. So it's good when you're limited on space, but it's also a very precise and gold standard of cooling as well. And because it's all integrated, it means that you don't have a separate device. On the flip side, though, it does mean that you have cryogen and cryogen canisters as a consumable as part of your treatment, which is an ongoing cost. But for some people, that's still the better choice when they consider the overall benefit and logistics of their clinical environment there as well. Oops, we've skipped to the end of our presentation, just moving back through right now. And so moving on as well, when we look at our handpiece there, what we can see is that we've got little tips that clip onto the end. So there are distance gauges, and they are available in different spot sizes depending on what we're treating. And just a little tip for you there now, which has become especially a consideration when it comes to the current circumstances that we have with COVID and people becoming extremely cautious about infection control and cross-contamination. We know as standard with our distance gauge tips, which are able to be disconnected and thoroughly cleaned from the device, that we have always had our extensive cleaning processes and recommendations in place when it comes to utilising those handpieces. But now we also think that it's a good option that people may choose to actually purchase their own personal tip, which they can take home and use just for them and return for their own treatments. And so when we think about infection control and cross-contamination and people's preferences for wanting their own thing for themselves when it's touching their skin, it's also just a tip for you there as another option. And also sometimes it can be a little bit of an additional revenue stream for your clinic, is that people may prefer to purchase their own tip, which they can either take home or keep stored individually on site for when they come in for their future treatments as well. So it's important to remember when we think about laser hair reduction and think about what's going to be relevant in our own clinic here is the two wavelengths that are available to treat different Fitzpatrick skin types. So ask yourself the question, am I looking at a demographic of clients that are coming in who are predominantly Fitzpatrick 1 to 3, or do I have my darker Fitzpatricks or a mixture of both? And it's going to guide your decisions about where the best place to start is with your platform. But indeed, for many, we like to be able to be inclusive and treat everybody, and so we will choose to have both wavelengths available to us. Timing of the treatments is important because when we manage our expectations with our clients and we promise a series of approximately 6 treatments, that recommendation is based on scientific evidence of the way that we should space treatments over different body parts. It's also important to remember that because we need pigment in the hair follicle, that's our preferential chromophore that the laser is looking for and seeking out, that treating white, blonde and grey hairs are going to be a treatment challenge because if there's no pigment there for us to see, then it's harder, there's no pigment for the laser to see. And so similarly, when we think about our redhead or auburn-head clients, what we need to think about there is with melanin, we've got pheomelanin and eumelanin. Eumelanin being our rich, darker, deeper, that the laser is very drawn to, and pheomelanin being more our reddy, browny colours, which the laser doesn't see quite as well. So people with red hair will have a treatment challenge particularly as hairs become thinner and finer and paler in colour. And so we should always manage that expectation from the beginning. And patients need to be informed as part of that process so that we can manage those outcomes with them effective. So within our wavelengths there, it's important that we think as well that when we are choosing our effective energies, that we also need to match that with the thermal relaxation time of the structure of the hair follicle that we're targeting. So we need to deliver that energy quickly enough that it will destroy the target, but also that it can safely disperse its heat energy into the surrounding tissue so that we don't cause any excessive collateral damage or thermal injuries. And so with Candela's laser wavelengths, both being able to treat 3 milliseconds as our shortest pulse duration for hair reduction is very important when we're thinking about having that effect for laser hair reduction as well. Moving on to our pigmentation treatments. So this is with our Alex 755 nanometer wavelength, benign lesions. So in a perfect world, we really would advocate that our clients who are seeking this treatment or who we're promoting it to will have had a valid medical skin check by a doctor or dermatologist within the past 6 months, so that we have reassurance of safety that the lesions that we are going to be treating are appropriate to be treated. And what we're looking at is epidermal pigmented lesions. And so when we think about epidermal pigmented lesions with the 755 nanometer wavelength, we've got a perfect capture audience here in our Australian population. Solar lentigines, so sun damage and photoaging, and then also freckles as well. Another option that can be treated are our little coffee spill birthmarks, cafe au lait macules. But cafe au lait macules, when we think about what our clinical scope of practice and our own qualification is, it's important to think that if we can't diagnose something, if we don't know what it is, then we should always ask ourselves, is that something that is appropriate for us to treat in our own clinical setting? But when we think about the sun damage in the paler Fitzpatrick skin types in Australia, we've got a huge opportunity here to benefit from using this laser wavelength as a pigmentation treatment for people with sun damage and freckles. Things that we need to be careful about when we think about pigment is what can be some underlying causes of pigment other than sun exposure. So hormonal causes or pregnancy, some medications or even post-inflammatory hyperpigmentation. So these generally are not conditions that we would recommend treating in cosmetic beauty environments with the 755 nanometer wavelength. We know with hormonal pigment that heat can be quite aggravating to that. And with pregnancy, we prefer not to treat people who are pregnant. It's contraindicated because it's a cosmetic elective procedure, and we always think about first doing no harm. People who are pregnant or breastfeeding, their skin can be unpredictable or unexpected to what the normal response might be. And with post-inflammatory hyperpigmentation, we, again, don't want to necessarily aggravate that by treating it with a heat-based laser as well. So sun damage and freckles is what we're looking at here with that. So how does it work? We're talking here about a heat-based laser, so long pulsed and 3 milliseconds, which I mentioned before, again with laser hair reduction, closely matches this thermal relaxation time of melanocytes. And so what we're actually doing is heating up these benign epidermal pigmented lesions. It's going to cause a heat damage that's efficient enough to try and fragment those so that our body can recognize it as damaged cell matter and can process that. So that's a photothermal laser, our gentle Max Pro 755 nanometer wavelength. It's like having a glass of water, a glass and slowly pouring boiling water into it so that pigment would then fragment. And then, of course, the other option that we have for pigment on the market is more of our photomechanical or photoacoustic lasers. So with those lasers, the pigment, instead of being heated up, it's literally shattered by mechanical energy, a little bit like a hammer smashing that same glass. And so we know that heat can be a concern and a risk when we're thinking about darker Fitzpatrick skin types. So for the 755 nanometer wavelength, we just recommend treating Fitzpatrick skin types 1 to 3, which perfectly matches our demographic for who's likely to have a lot of sun damage or freckles anyway in general. For darker Fitzpatrick skin types, the safe option is to look at our shorter pulsed lasers, such as picowave or picosecond laser or nanosecond laser as well, where there's more of a mechanical effect and less of a heating up effect on the pigment. So some experts may treat a very light Fitzpatrick 4 with caution, but we certainly recommend Fitzpatrick 1 to 3. We know if we think about a Fitzpatrick 4, an Asian skin type, for example, they have an increased risk of post-inflammatory hyperpigmentation and may react in an unwanted way that would outweigh the benefit of the laser. It's important that people have their skin checks. Because our target is epidermal, this is why we do not use DCD or cooling during the procedure, because we want that heat energy to be attracted to our target in the epidermis. And we never promise a one-hit wonder. We always need a series of treatments, which means that we have an opportunity for people to commit to coming back into our clinic as well. And we've got different treatment techniques that you can utilise, whether or not you want to do a spot treatment or whether we want to do a whole field or diffuse treatment technique over a whole surface area. And so again, we've got different ways that we can treat different types of people that will be coming into our clinic there as well. And now we've got our vascular lesions using the 1064 nanometer wavelength. So what we're really looking at here is being able to treat facial vessels and then also leg veins. So really we need to emphasise, as with all laser, that the device can do wonderful things, but we also must take into consideration the scope of practice and the experience and the clinical expertise of the person that's holding the device as well. It's an extremely important part and piece of the puzzle that we certainly have with the GentleMax here at our 1064 nanometer wavelength, which gives us this wonderful capacity to be able to treat these things, as well as Campbell de Morgan spots, and we've got facial vessels, leg veins, and also a treatment where we can treat flushing and blushing or diffuse redness as well. And so again, when we think about people who might be coming into our clinics, we know that with paler skin types, that certainly vascular abnormalities and changes can be an issue there as well with our paler Fitzpatrick skin types. So you could still treat a Fitzpatrick 4 skin type for vascular lesions there as well with the 1064 nanometer wavelength. We know that this is a safer wavelength that's travelling deeper into the dermis. It's attracted to more so deoxygenated blood. So here we're thinking our purples and our blues, which is why it's great for our leg veins. And it can also be used as well in medical settings by appropriately qualified practitioners to treat other clinical indications as well, such as venous lakes, warts, and in some cases even some resistant nodular port wine stains as well. But it's very important that we consider the scope of our own experience and the setting with which we're operating, what kind of indications are going to be appropriate for us in those environments. So with our little leg veins here, spider veins, we still understand that sclerotherapy, where those vessels get injected with an irritating solution such as hypertonic saline or polydocanol, it's still the gold standard for the treatment of leg veins in the industry. But there's certain times where leg vessel collections may be appropriate to be treated with laser and may be a preference for our client or our patient as well. And so really the benefit that we're looking for here in being able to utilise this all on that same platform with the GentleMax is for patients who are coming in with small little spider vein collections. Perfect examples of people who may come into clinic for this are women with post-pregnancy. It can be quite common for them. People from professions who are standing on their feet all day, such as nurses, retail staff, beauty staff, are another sort of catchment of people where these might be people who could benefit from this treatment in your clinic, just to name a few. And what you can see in the pictures on the bottom there of this diagram is something else that's unique and a benefit with Candela and is used in this platform as well as with our VBeam Prima dermatological platform, is the 3x10 elliptical spot size. So in the pictures down the bottom there, you can see that not only have we got our standard circular spot sizes, 1.5 millimetre for the face, and then also 3 millimetre, which you can use on the legs. But we've got this linear spot, so it looks a little bit like a cat's eye, some people call it, which allows us to treat more of the vessel in one go, which in turn can also help to spare the surrounding tissue more when we're using these very high effective energies. And what we hope is a good clinical endpoint for this treatment is that we may see a vascular spasm or disappearance of the vessel, but also a cat scratch appearance after about 5 minutes. And here we have facial vessels. So we just want to use our 1.5 millimetre spot size for facial vessels, and we can get wonderful clearance over what we normally recommend as being between 2 to 4 treatments. So some people are lucky and they will get clearance sooner, but we also know sometimes that vessels can be stubborn and recalcitrant, and so we always promise a series of treatments. For leg vessels, that means they would be spaced about 12 weeks apart. And for facial vessels, we'd be looking to have people to come back in about every 4 to 6 weeks for that series of treatments there. Usually with smaller vessels, the vessel will spasm and disappear on the spot and just leave a little bit of residual pinkness. But sometimes the vessel will look a little bit darker. And because we're using such high energies, clinical training and expertise is such an important part of these blood vessel treatments. So this is really a treatment that you would want to aim in your clinic for experienced staff who have spent quite some time exploring laser hair removal modalities and really understand the concept of laser parameters and how they work together in order to achieve our clinical endpoints. Finally, we're just going to touch on the neocollagenesis, or what we also call wrinkle reduction and skin tightening technique. So again, the benefit of the GentleMax laser platform here is that it has the capacity to have microsecond pulses, so down to 0.25 microseconds. And what that means is that we can have a bulk heating heating technique using our 1064 nanometer wavelength that is going to contribute to collagen contraction and collagen stimulation over a course of treatments. So again, we've got an option here that might be a step up from facial beauty treatments for some clients who are looking to engage in something that allows them to actually have some new collagen stimulation or creation, which we know sort of depletes by 1%, definitely from our 30s. And we can do this on all Fitzpatrick skin types as well. So again, we've got an inclusive option. It's a very technique-driven procedure where we're trying to aim for a particular temperature on the skin in order to trigger this chain of events that helps to stimulate new collagen and remodel existing collagen in the body as well. So a lot of people refer to this as a lunchtime laser, which means it's a minimal to no downtime procedure that people can do in a short amount of time. It's comfortable for them. They can do it on their lunch break and they can put their makeup on after and get back to business as usual. So again, we've got something that's timely that you can use in this platform to again increase the opportunities for treatments that you've got available within your clinic. So the last thing that I just want to end with here is what I've called consider your own treatment triangle. So we've really talked about this wonderful device platform that we've got using 2 different wavelengths, but because of the cooling options we've got, the variability in the pulse durations and the energies available, that we're able to treat various clinical indications. So other than having this wonderful device platform, it's very important to understand that to achieve this therapeutic operation within our clinic, where we're having safety first and foremost, and then also good results, is that we need to consider the practitioners that we have working there and take advantage of the training that Candela offers for the complete 3 years throughout your warranty, and then furthermore with your service contract, where we can assist in helping to upskill and make sure that the people who are using the device for these additional indications can use it to the best of their ability to really achieve these safe results that will also benefit your clients and the return of investment in your clinic. And then you also just need to consider who your client, who your patient is, who are the people that are coming into your clinic, what skin type are they, and what treatments do they tend to be seeking out. And that should be where you look to focus your next step in your journey of what you would like to achieve with your treatment platform beyond laser hair reduction as well. And then that allows you to give your staff training time and opportunity, and it also gives them job satisfaction as well when they can move beyond their original scope of practice too. So I'm going to end it there. I've gone through very quickly that last part at the end, but if anybody has any questions, please, now's the time.
Thanks, Margaret. It was a really comprehensive webinar. I'll now pass you over to India. She has collated the questions from the attendees.
For the first question, what is the mechanism of action for laser hair removal with 1064 nanometer, and how does this affect clinics with a predominantly Fitzpatrick 4 skin type clientele?
Yeah, look, the Fitzpatrick 4 skin type clientele is always a challenging option. But what we know is that when we're dealing with those darker Fitzpatrick skin types, is that we really need to be first and foremost safety conscious when they have competing chromophore in their skin. And sometimes that does come as a sacrifice, which may require them to need extra treatments. And so with the 1064 nanometer wavelength, we can see there that it still has some attraction to the melanin chromophore, but also it travels a little bit deeper into the dermis away from that upper level where the competing chromophore is. And so we are still trying to get some attraction to pigment, but also to be targeting and attracting the hair follicle structure in the skin there as well, the bulb, the bulge, and the matrix supply. And so we do anticipate that people who are using the YAG wavelength are going to need more treatments compared to people who are using the Alex wavelength. But it's all about getting to that endpoint in our journey safely. And if that means the difference between being the tortoise or the hare, we're both going to cross the finish line, but we want to do that in a way where we first have no harm for our client as well. And that's just part of managing their expectations in the process. But I do understand probably where this question is coming from, that we certainly have skin types who sit on the cusp with Fitzpatrick 4, and experienced users may, with extreme caution, use the Alex 755 nanometer wavelength to treat certain kinds of Fitzpatrick 4s who are very light, for example, less than a Fitzpatrick score of 22 as a rough estimate. But really what we need to think about here is our Lancer ethnicity scale as well. So what's the ethnicity of these clients? Often one where people find some confusion between the two wavelengths is when we're looking at Middle Eastern skin types, because they can appear to us to be something that ranges from quite pale to something quite deeper within that Fitz4 realm. And while some of these people do expect that they've received a sooner result when using the 755 nanometer wavelength, we really need to consider how far we can progress when we're going through our settings in a safe manner in order to achieve that final result as well.
When working with a specialty laser hair removal handpiece providing a 20, 22 and 24 millimeter spot size, how do you decide which spot size to start with?
Yeah, so if I was treating on the body, then I would probably opt for my largest spot size. So we already saw the diagram there that shows that clinical benefit of being able to use the biggest option. But we also need to know that our spot size is going to be appropriate to be able to manipulate and treat on the area that we're treating. So generally with the body, with that large specialty handpiece, we'll often start with 24 on the body and then probably a 20 millimeter spot size on the face. We're treating a smaller surface area there, and it makes sense to us that using the 20 mil spot size allows us to manipulate the area a little bit more easily. But in addition to that, also when we think about our spot sizes, I guess you could say in a way the laser needs to work a bit harder to make its energy for that larger spot. And when you look at your settings guide, what you'll see is that the difference between the 24 millimeter spot size and the 20 millimeter spot size when it comes to the fluence, the energies that you have available, that the 20 millimeter spot size lets you have a little bit more energy, a bit more fluence available. And so when we think about hair structures on the face, such as a female upper lip or something like that, we know from the outset that those hairs are finer and they're likely to need a greater fluence or heat energy sooner to achieve a clinical endpoint as well.
What would be some of the questions you would ask during a consultation to be able to secondly assess proper suitability for treatment for epidermal pigment reduction?
Yeah, look, it all absolutely starts with an assessment pre-treatment. And so the first thing that I would always be ascertaining is what their Fitzpatrick skin type and what their ethnic background is as my starting point. And then I would be thinking about my safety concerns. So I would really like to know, I believe, that they have had a valid skin check within the past 6 months by their derm or doctor. And then I would be further assessing a little bit more as part of my consultation about what their concern is. So obviously what the client sees is the most important thing. And we always think when we're making an assessment about look, listen and feel. So what can I see? What is my client telling me? And I guess feel, sometimes that's more with laser hair reduction, but certainly when we think about feel with pigmented lesions, we also want to assess that we're not going to be treating over anything raised. We're just looking at flat, benign epidermal pigmented lesions here. So that would form the first part of my consultation process. And then I would think about managing my expectations with my client. So is the pigment pale or medium or dark to begin with? We know that paler pigment has less target. It's harder for the laser to see, so to speak. And so that's going to be more of a treatment challenge. And so my next part of the consultation would be managing that expectation when I'm talking about the 3 to 4 treatments that the client will need. And explaining what we might guess that the expectation might be based on the pigment that we see before us as well. And then I would make sure as well as part of my consultation that they're going to be compliant in the process. We need our client to be strict with their sun protection and their aftercare. They really need to be a partner in that journey with us as well in order to have safety pre and post treatment, but also to maintain their results too over the course of time.
How soon can we combine laser for thread leg vessels with the sclerotherapy? Can they be performed in the same treatment?
Yeah, that's an interesting question, and it brings to mind a webinar by one of our mentors in the UK, Dr. Faraz Al-Naimi, that I was listening to last night actually, where the same question I believe got asked. And there was also another webinar by one of our US doctors. And the answer here is that that's going to depend on the clinician who's treating. And so really that should be at the discretion of those. In the instance of the US doctor, they did mention being able to treat both in the same treatment session where clinically appropriate, but we don't have any specific guidelines or recommendations that I could tell you directly as part of our standard treatment protocols with Candela. So that again comes down to the clinical expertise of who's overseeing the more invasive procedure, I guess, as well, being the sclerotherapy.
Can the 755 nanometer treat both epidermal and dermal pigmentation?
With the 755 nanometer wavelength, we don't recommend treating dermal lesions with that. I think that we know these days that there's safer technologies such as using pico and nanosecond lasers in the skills of an appropriately skilled person. And usually when we think about that, we're probably thinking a dermatologist or a doctor, for example, when it comes to treating dermal lesions. So we don't recommend treating dermal lesions in cosmetic or beauty clinics with the 755 nanometer wavelength.
If you are not sure about a client's Fitzpatrick skin type, what else could you ask the client for their ethnicity?
If you're not sure about their Fitzpatrick skin type, then I guess the most important thing is that you need to use the assessment tool. So that's also available through Candela, where we have a number of questions that the patient will answer and circle, and you add up the numbers and that will give them what we call a Fitzpatrick score. And this is a guide, an assessment tool that helps to assist in your own clinical judgment about how we decide treatment parameters for the client. So other than us using an assessment tool to assess their Fitzpatrick skin type and considering their ethnicity, I would also then consider about perhaps some of their lifestyle factors when I'm considering about where I might go with my treatment parameters and settings, such as any occupational sun exposure, what's their career? What are their general lifestyle habits like when it comes to being compliant in their treatment process as well?
And if you are new to this industry and need one device for various indications, which device would you recommend and why?
Well, look, I think when you think about that the GentleMax Pro Laser, based on what we've just said, if you're new to the industry, I would be asking myself, if it was my clinic, who are my patients that are coming in and walking in through the door? And that should really be one part that forms the answer to that question. The second part should be who am I and what's my scope of practice? What am I capable of treating in my clinic? What's my clinical expertise? And how could I manage the after effects in my clinic as well? But certainly when we look at the GentleMax device here, we can see that other than having the gold standard for laser hair removal, that when we look at actual skin treatment and skin benefits, what we tend to like to have is an option where we can treat colours and then also an option where we can create collagen. And the GentleMax Pro lets us do all of those things. We can address reds, we can address browns through pigment and blood vessels, and then we can also use our collagen induction technique to get some neocollagenesis as well. So I believe that would be a good option if you were starting out, because we're covering a broad spectrum of people who could come into our clinic.
Marguerite, thanks so much for your really informative webinar this evening. We really appreciate your time. Our RC Expert webinar series will continue. We'll be going back to fortnightly webinars starting from next fortnight. So our next webinar will be Monday the 13th of July, and we'll be discussing our 2 new peak away handpieces. Thank you for listening. Have a good evening.